Welcome to Treatment of Addictions, Psychosocial Interventions. In this module, we will learn that there are important psychosocial factors that can influence the development, maintenance, and treatment of addictions. The recognition of psychosocial factors in the development and treatment of addictions is not a recent event. In 1804, Thomas Treuter recommended that physicians and patients should meet regularly to formulate and implement a sobriety plan. The treatment of drunkenness was a disease of the mind. Several inebriety asylums were created in the 19th century as addictions started to be seen as a medical problem. But as we realized how challenging the treatment of addictions was, other treatment options were developed. Some of these treatment options were not developed by the medical profession, but by the patients themselves. In 1935, Bill Wilson and Bob Smith founded Alcoholics Anonymous. And 2 decades later, Charles Dedrich founded the first therapeutic community. These are 2 major and lasting contributions that we will cover in this module. We will also look at specific individualized interventions, such as cognitive behavior therapy. And we will understand the importance of family members in the treatment of addictions. We will also learn about interventions specifically designed to treat addictions, such as relapse prevention, motivational interviewing, and contingency management. Many of these interventions proved to be effective and were later applied to treat other psychiatric and health conditions. Another intervention that has gained much attention in the treatment of addictions is mindfulness. This is a dynamic field, and we will make sure the module is updated with the latest treatment options in our field. During this module, you will discover several interesting approaches and understand their theoretical underpinnings and clinical applications. Most importantly, you will understand the evidence-based supporting the effectiveness of these treatment options. Few people truly understand how to judge whether an intervention is effective or not. By the end of this module, you will be one of this few. You don't need a degree in psychology to enjoy and thrive in this module. No matter how much prior knowledge or interest you might have, by the end of the course, you will understand evidence-based psychosocial interventions and how they can be translated into clinical practice. I hope you discover that this is an incredibly fascinating and essential part of addiction treatment.